Hi everyone, this is my final project paper review. So this is the name of the paper. It's Checks Readinet paper. The heading of the paper, it's using radiomics as prior knowledge for Therox disease classification and localization in chest X-rays. Uh, let's go into the topic now. So starting with the project. Let's start with the big picture here. The chest X-rays are used a lot in hospitals because they are very cheap and fast. But radiologists have to read thousands of them every year. So that's kind of burden for the doctors and radiologists. So sometimes there is a possibility for human error, which would be disastrous for the patients looking for any signs of chest related diseases. So that's where we bring AI. In last few years, deep learning models have improved very well in image recognition, and people are trying it for medical images too. But there's a problem. These deep learning models, they are like black boxes. They give answers, but doctors really don't know why they are giving such answers. So this becomes not so trustworthy way of uh, finding or classifying diseases. So in this paper, the Checks ReadyNet, they try to solve mixing deep learning with something called radiomics. Radiomics is like basically a uh, set of features like shape of the tumor, texture of the lung tissue, or pixel brightness, etc. So if doctors can know what actually is happening, it would become easy for them to recognize and actually provide the patient with more precise information. So in this project, it is about segmentation, basically draws precise outlines on medical images. And I think this paper is relevant because it shows how combining AI with radiomics can make results more accurate and more interpretable. Coming to the explanation of the paper, there are two parts, and the in the methodology there are two parts. The first part is classification. So here the paper uses neural network called ResNet with a little twist called triplet attention. This triplet attention is used to check if any of the 14 diseases are present in chest X-rays. So it outputs probability with each disease like 70% pneumonia or 20% normal and so on. The second part of the paper describes about localization and radiomics. Once it predicts a disease, it tries to highlight where exactly in the lung the disease or the abnormality is located. It does this by generating a heat map, kind of like a spotlight on a X-ray image. From that, they draw bounding boxes and the problem areas. Inside these boxes, they calculate radiomic features like intensity, shape, and texture of the abnormal region. Then, then the clever part comes in. They force the deep learning features to align with the radiomic features. If they don't match, the model get penalized. So in short, one branch predicts diseases and the other branch the area and compares it to radiomics, and the two branches learn together. This is why they call it end to end. So trying to understand the results and findings. The model was tested on various data sets like chest X-ray data sets, NIH Expert and MIMIC, etc. For classification, they used AUC, which measures accuracy. Which is higher is better. In our case, it's around 0.84 average AUC. For localization, finding where the disease is, they measured overlap with radiologist boxes using IOU. Again, higher is better. The model outperformed other models across different difficulty levels. Finally, they did an ablation study. Basically, they turned off the radiomics path. When they did that, accuracy dropped. That showed radiomics really made a good difference. So, if I want to criticize something from this paper, First thing, the bounding boxes they get are from heat maps, which aren't super precise. So they are fuzzy blobs, not certain clean outlines. So localization is okay, but not perfect. And radiomics features are handcrafted. That's both good and bad, because doctors understand them bad because they might not capture everything the AI could learn on its own. And yeah, what I did learn from this is adding radiomics as a guide can improve accuracy and make results more interpretable. In my project, it is about testing and benchmarking segment networks, multiple models like unit, attention unit, and so on medical images. These models are like great at drawing boundaries around organs or diseases, but sometimes they miss small details or produce false positives. From this paper, yeah. Of course, there are challenges. I have to decide which features to align and make sure I don't restrict the model too much. But overall, this is a good lesson I can carry over. Using radiomics as a form of prior knowledge can boost both performance and trust in the results.